delegates, seniors, and dear students. Before I begin a talk, I want, sir said, I think we should think why this topic has traditional bedside clinics to use of digital tools. I believe that this is not this is not. But as a clinician, how we inculcate this digital. So I'll be talking on this. These are my contents. So as we know, bedside teaching, as Dr. Mahesh has already highlighted, the bedside teaching is the foundation, and from where we, as a medical faculty, I think most of us have learned and patient interactions are learned mainly because of the bedside teaching. And now I think Dr. Mahesh has already, he is also speaking. Why is it so bedside teaching is better? Why the concerns are arising? Because of rise in the simulation-based models and increase use of digital platforms. And nowadays, we are also from anatomy only enrolling MBBS. At the time of joining only, they are enrolling in courses which are having the digital access. Wherein apart from learning theory, they are learning the bedside clinics also in the digital media platform. So, and the generations which we are getting as students, they are Gen Zs who are already tech savvy and who are well versed in the technology, and they are very well connected compared to us, and they want to use tech as a basis of their education. And because of that, because of these reasons, what is happening, there is reduced patient context. So definitely it is a concern. So how I see, rather than ignoring or over-relying on the technology, we should do it as a bridge to connect the theory to the patient care. Because nowadays, as already been highlighted the initial talks, nowadays the doctor and student ratio, the faculty is maximum which NMC CPME clarifies, but nowadays the students using the tech, I think we may not be able to do the justice, so definitely that is required. So we should also overhead projectors also we should use. Nowadays, whatever percentages we are getting, they are having the use of the multimedia and along with the AI also. So see, what's happening because of that, students are getting interest learning, they are getting interest also. And headed by the Dr. Premdev sir and Srivastava madam. So in that, one of the talk was there, Purva Lohia madam's talk. So what I got to know is like almost all students and even other faculties also, they got very fascinated and they were listening very keenly. Because having a lot of AI and multimedia, because nowadays attention span is also coming down. The interest with which the students are learning was higher when they are being exposed to the multimedia approaches. And as I said, technology will enhance the teaching, because we can show that in virtually, also properly we can demonstrate the images. And accessibility. See, if the students are having the digital content, he can access in 24/7. I think even Shuddha sir is also having this app, and because I do see most of the students following apps where they can, even in the 24 wherever they leisure time, wherever they get time, they can access the technology, and there also not only e-learning, there even bedside teaching are also happening. Like even we do see the DIB models wherein regular case presentations are also happening over there. So there also students are learning. So I think that would provide a definitely better approach. And nowadays, as you see, high fidelity simulators are also there, wherein one can see whether, I think we are already using advanced modules like PALS, NRPs and all, wherein we can see whether proper integration is happening and all. And even simulation and debriefing is a part of NRP. So where we get video record and later on we give where they are making mistakes, so students can correct better. So I think, and because of that there is lesser harm to the patient. So and we can minimize the consent related issues and ethical issues. So definitely technology, how I see, we have to use and it could help. So simulations lab, I think, as I said already, they are part of the medical training in anatomy, surgical wards, because there in bedside teaching, though they may teach differential diagnosis part and management part, but but the real-time management can be done with simulation, and even definitely they can do on patient. But with the increase in doctor-patient or kind of a student-doctor ratio, that may not be practically feasible. So in virtual reality also, especially it is helpful in seeing rare patients or even in rare internal organs where we do just imagine, because most of us we have learned the medicine by learning from textbooks. So there I think I think we might have had doubts, but there we had no opportunity to go back and see those structures, cardia, internal cardia, and all. So now with virtual reality 3D models, we can see and we can visualize it. And with telemedicine, already it is happening, wherein DIP models, case presentation will be happening, and faculty from other places, because in remotest area we will not get the senior faculty who are there. So such faculty also can be part of bedside teaching of the remotest place, and we can also discuss and share his knowledge with that students, and there they can magnify their quality and they can improve their knowledge. So this use of technology, the science has become uniform. Even the people in the remotest villages are also able to connect with the senior faculties who are sitting at capital city and other big cities. So AI in diagnostic, I think this is the talk of the town, wherein everyone is trying to evaluate how AI will help in diagnosis of X-ray, MRI, CT, and few of the countries in here also everyone is trying to utilize, because of so much of patient load, where we may not get, even after doing the investigation, we may not be able to get the reports early. So everyone is trying to evaluate what is the role of AI out there, and definitely over a period of time, I think guidelines and recommendation will come, and we have to utilize AI even in the diagnostic tools. So portable tech devices, I think as of now, I think in NICU, where even there also bedside teaching is happening. So there also we are using, we use bedside sonography also, we see the abdomen ultrasound. So focus and pediatric also focus is the part of standard care, wherein we are able to see that. So definitely it would allow better visualization and confirm our findings. Those days we used to tell inspiratory findings are confirmed by palpation, and over a period of time, I think palpatory findings are confirmed by the focus or sonography we need to tell over a period of time. So Dr. Mahesh also has pointed out, so is told the digital health records will increase the burden, but digital health records in other ways were improving our knowledge. I think digital record will help us to minimize our work, because writing and finding nowadays, especially searching the file, has also become very difficult. With electronic health records, we can easily find out the data. I think most of the studies which we are doing, retrospective studies, they are based on electronic record data only now. We are able to find out easily. So, as I said, technology enhances the bedside teaching, because we can integrate our traditional teaching along with technology, and live images also can be shown there only, and it will magnify, or it will help us assisting and to improving the quality of our care. As the one thing in the technology, though it may help us, but the human touch, humanistic touch, may not be possible with the tech. There, I think humans are required, and there, as a bedside teaching, as highlighted by Dr. Mahesh, it has skill role. And soft skill also, as in bedside training, we need to teach students regarding the listening and professionalism over there. And over period of time, I think we should integrate tech also. I think the evidence from many studies shows that blended learning along with the tech is definitely helpful, and simulation before the bedside improve the performance, especially in the procedures. And globally also, medical schools, they are integrating AI, they are finding it is helpful. Challenges to address, I think most of us we are facing, because of students are, even in the class also, most of the students are, they are not attentive, and attention span is coming down. So what we should do, we should avoid the reliance on the technology. And see, though students are tech savvy, but all faculty may not be that tech savvy. I think over a period of time, faculty teaching regarding the technology is also the need of the hour. And we need to maintain a balance. That's how I feel. And the future of medicine definitely is going to be already we are integrating because of so many reasons. And it is going to be a hybrid. And in COVID also we have adopted this model. So definitely need of the hour. So how I see technology as revitalizes the bedside teaching, and best outcomes are possible if you integrate the tech versus our traditional learning, and it is to reinforce rather than replace the bedside teaching.
Thank you, Dr. Rajendra. So,
there we can use the medical to search the literature, to show the images, over a period of time to show the videos, and artificial intelligence, augmented reality to show the organ images also. We can show there only so that student will have the practical feel of that. Because most of the time we imagine, okay, it is there inside. Because you would have seen the liver, but the person who has not attended anatomy properly, he will not be, he will be depending basically on the textbooks, wherein he will be having the 2D images. With 3D images and all, he will be able to better visualize that.
you are taking.
I think, thank you very much, Dr. Rajan, for accepting many of the things that bedside teaching cannot be replaced by technology. That is a fact. So, here one of the part that there is a role of application. But I think many of us use the application, and every time when you open the application, you forget the algorithm. Because the person in the computer who made the algorithm, he will remember each and everything, because he knows that after that what will come. But when I start putting my documentation, I usually put the value and come on to the result. So I think that is a disadvantage that what we are having, and I already talked about the cognitive imbalance that will be there. So I still feel, so my take on this as if Dr. Rajendra is there. So my take is there that still the bedside teaching should be a part of at least 70 to 80% of the bedside teaching. There is a role of AI that should be there. At the same point of time, Piyush was told about there is a policy problem related with this, because there is a lot of students that are getting admitted. But I think, sorry sir, but I think as a parent, when we reach to a certain stage, we feel there is a less medical seats are available at that point of time. But when we realize this is not the problem with the medical students in our country, I think this is the problem with the resources. Now, number of faculty is also reduced by the administration and the policy makers. That was the primary reason why this thing is going down. So I think that needs to be.
Sir, actually, what's happening? Even in third standard, government is planning to introduce the AI curriculum. So from there only, the students are exposed to technology. And now after coming to professional courses, we are restricting them. So you restrict them, your students are less. Ultimately, they are going to learn only. So I think we should adopt it as integration rather than ignoring it.
Yeah, thank you. So at the outset, this is very important because of late we are seeing an increase in the medical colleges in the postgraduate number of seats as well as the UG seats, but at the same time are the faculty being equally increased in the colleges. Number one. Number two, private college, the colleges are being given, but the infrastructure with respect to the number of beds or the equipment is it being looked into. So classically we used to do the bedside clinical teaching, and before these investigations were available, we used to make a differential diagnosis, and the site of the lesion also we used to pinpoint. The investigation usually used to confirm it, our diagnosis. But with the, post-COVID, we have seen a lot of digitalization and a lot of screen time, which also has affected the cognitive intelligence. And they should go hand in hand, balancing should be there, but not one overtaking the other, because that will lose the human touch and also our understanding of the clinical, like when the patient walks in, we identify based on the attitude and the face whether the child is sick or alert or so that we should not lose. There should be a balance between the both. Thank you.
I completely agree. Bedside teaching is the soul of the medical learning. and we as a clinician and adopt the new technology and see how we can improve ourselves with this technology. That's what. Thank you.